call Dr. Nacho. We have an awesome interview with a real life dentist on the street. She's not on the street, she's in her dental practice. Dr. Melissa Santilli, who has an awesome associate position available in North Dallas. We're going to talk about that. Welcome to Talking Nachos, Dr. Melissa. How are you doing today?
Good. How are you? Thanks so much for having me.
So thanks for jumping on here. We see you're in your office, and we're here to share. My whole goal is to help connect dentists for awesome opportunities. So, there's many dentists looking for jobs. There's practice owners looking for associates. Let's find out what you have to offer. So first, let's talk about where this position is here on earth. So in North Dallas, I'm here in Philadelphia. Share with me where this position is.
So it's north of Dallas. So it's kind of, I have two practices. One is kind of between north of Dallas and Oklahoma, kind of on that border, closer to Dallas than Oklahoma. And then one is a little bit further south into Dallas, but not like Dallas city, both are in suburbs.
Gotcha. So you have two opportunities. So I like to help dentists with systems. Everything that matters needs a system, and everything matters. So we're going to talk about three things that every practice owner and every associate should ask or know how to answer on an interview. So first, why are you, Dr. Melissa, looking for an associate?
So, being out of school, I started my practice from scratch, and after opening for 5 years, I opened two. And I'm really good at running the business side. And I just feel like my passion is more playing the insurance game and making sure a dentist is paid fairly. And so I feel like my talent's better used in that way than being chair side. That said, I produce over 1 million myself just doing both. And I have 4 kids also. So I got pregnant in dental school. Then I had 3 more kids while running my practice. And even with that, my production kept going up because I just kind of figured out this insurance game. And I feel like my talents are better used more on the systems and the front office side than chair side, because I feel like I can plug some really good dentists into these positions and help them earn as much money as they want.
That's awesome. And that's really good advice.
Yeah.
Dr. Melissa, 4 children, 2 practices, that's 6 things every day that need your attention. So I totally see. I'm a practice owner myself. We have 2 practices. Why you want to help? So that's a great why. And what you shared there was important too, because you shared with me that you've done extensive training in full mouth rehab, and you do Invisalign. Right. So it's not just you're a business dentist who hasn't done it. You actually want to start to mentor an associate so you can expand what you do and also get more time with your children. So awesome. Now, let's say I'm applying for a job. I'm saying, okay, I can go to North Dallas. Sounds like a good why. What procedures am I going to be doing when I start? I join you, work 4 days a week. I know you have 8 to 5 type hours. What are the procedures that I'll be doing?
So with new associates, I really want to know that you can do solid, good bread and butter dentistry. So you're going to be doing root canals, crowns, bridges, fillings, just kind of foundational kind of dentistry. And if you show me good quality crown preps and consistency and everything that you're doing according to our standards, because we want to have high standards for our patients. Our reputation is solid dentistry that's going to last more than 30 years. So if I feel that you care and you're ready to learn, then we're going to put you through some more challenging things. And so I'm very open-minded to pay C as long as it benefits the patient and benefits us as a practice. So at the beginning, it's probably going to be C that's more foundational, like a couple root canal classes, a couple, cosmetic restoration things. But before you jump on the full mouth rehab and all this other stuff, I need to see some solid dentistry for at least a year or 2.
I love that. And also, I'd like to interject, because anything I try to do, I love Gary Vaynerchuk, just trying to deliver value. I was in charge of teaching my 5-year-old to ride a bike during this coronavirus crisis, and she did awesome. But many times you say, why can't I ride down this hill, or why can't you? Well, first, while it was a danger to her, I also knew that if she tried something too hard in the beginning, she'd want to give up. And that happens in dentistry too. So if you're a dentist out of school saying, oh, but I really want to do this advanced procedure, get the foundational stuff done first, so you build your confidence, because the worst thing is to try this advanced procedure, have it not go well, and then give up on it. So I think that's a great way to teach. Now, another important question, Dr. Melissa, is I'm a dentist, I have debt, I need to make money, pay my loans. How will I be compensated? And is there a daily safety net guarantee for this associate position?
Yes, absolutely. So we always have a daily safety net that never goes away. It's not like other practices where it's like goes away in 3 months, 6 months. It's there 5 years from now. I don't really care. I really feel like the dentist needs to focus on the dentistry and not worry about is there anybody showing up tomorrow? That's my job. My job is to market for you. My job is to work hard for you so that you get paid by insurance for the stuff that you did and you didn't do it for free. But it's just this big thing that requires a lot of attention. And so that's kind of where I feel like my focus should be. But in terms of clinical skills, I have still very high standards. I want to make sure that who I let touch my patient base and the patient that trusts me, I feel confident in their skills and their ability to deliver high quality dentistry. So the only thing I ask of my associates is, number one, you are wholeheartedly willing to do good dentistry. Like, you're going to step up your standard. Number two is you're open-minded. You know, you're open-minded to learning, you're open-minded to coaching. You know, being humble is one of the greatest gifts I can teach you and for you to have, you know, because there's always more to learn, and you don't want to be so overconfident that, you know, I'm going to jump out of dental school, I'm the best, and I'm going to do this, that. Well, guess what? There's a lot that you may not know, and what you don't know can hurt the patient. And so that's one of the biggest things that I want to kind of ease them into it. But I don't want them to worry about, well, if I'm not ready in 6 months, what if I don't have that daily guarantee?
I'm with you as a practice. We're very of a lot of similarities as a practice owner. I believe the daily safety net guarantee is something that should stay forever. People should know they can pay rent and do things, but then they have the opportunity to earn more on percentage of collections, a win-win. So, I mean, you have an awesome job here available. How can people reach out to you? If they said, hey, I'd like to learn more about this at your position, what's the best way for them to reach out to you?
They can email me, honeydentalsmile@gmail.com. They can reach out to me on my, website, honeydental.com, Instagram, honeydentalsmile. I'm kind of all over the place, Facebook, however you want. One of the things that I think is really useful is once they kind of get used to being more independent and able to carry the weight of the production on their own, because I'm still going to be around. I'm not going to just let them swim and drown by themselves. Like, I'm going to be around. If you make a mistake, that's sometimes how you learn, and I'll bail you out. But I'm not going to just,
Dr. Melissa, and my brother and I are the same way as owners. A lot of it's really having a friend in your phone you can text with a question. And, I know a lot of young dentists think you're going to text a question, does this crown fit? A lot of it has to do with patient management, practice management. Should we do this? And that's why when you have a mentor like you available, really basically all the time, whether it's through your phone, whether it's through FaceTime, whether it's so valuable to someone in their learning experience, because so many things happen during a day where you just want to reach out to someone and ask a question.
Yeah. Like when the way I kind of train is you watch me first, let me do the procedure. I make PowerPoints step by step so you can like mentally prepare yourself. Then when you're doing it, I'm kind of around. So if you run into a hiccup, grab me, I'm here to help you. I can bail you out. But that way you feel like there's somebody there supporting you, holding your hand. But at some point, I'm going to let go a little bit so you're more challenged and kind of go on your own. And so
that's a great way to be as a mentor and leader. I think you have an awesome why, how, what, your story to reach out to you. What's the website again to reach out to you?
honeydental.com.
honeydental.com. Awesome. And Dental Nachos, if you're watching, jobconnect@dentalnachos.com is how we set these things up, how you advertise awesome job positions and connect. But before we jump off, I have a special treat on this fancy sign. Everyone likes free stuff. So if you would like to get free stuff, you just text the word nachos to 215-543-6454. And if you want to find out about Melissa's job, you just text the word Dallas Jobs to 215-543-6454. I really liked, Dr. Melissa, how you said you're available in so many different ways, Instagram, Facebook, and that's what we need to be. Mechanism of connection is so important. So just find out, keep up the momentum, reach out to Dr. Melissa. Hey, it's just important to have phone conversations to learn more. You may be in this area. You may want to move to this area. It sounds like, you have raising your family there. Where do you live personally, Melissa? How far away from the practice?
20 minutes from both. So awesome. I'm kind of in the middle. And one thing I do want to mention is, if they're female or male, doesn't matter. We do offer PPO, medical, dental, vision, and life insurance. And we also have incentive programs where if you're a couple years in and you're producing at certain amounts, we throw in other benefits, such as we'll cover some of your student loans and stuff like that to help you hit your goals.
I love that. That's great to have those really value-added benefits that, all those health insurance, vision insurance, things like that. You really have put together an awesome job. So I appreciate you talking to us, Dr. Melissa.
Thank you so much.
Enjoy the rest of your day. Dental Nachos crew, reach out to Dr. Melissa or us at jobconnect@dentalnachos.com. Have a great rest of the day.
Thank you so much.